Everybody, and welcome back to the Weiner Wellness Virtual Summit. You're in for a special treat and one of my absolute favorite topics in a new product line that we've brought into the Weiner Wellness Center, which is Biocide. With me is Alia Khan-Elhady. She is the lead clinical consultant at Biocide, and she will be talking about Botanicals, a tool for balancing the microbiome for optimal health. So I'm so glad you're here. Thank you for being here. I'm very excited to hear this, and I'm just going to step back and just let you take it away.
Sure. Thank you for having me here. I'm pretty excited to talk about one of the things that I love talking about, the microbiome. And I'll give you a little bit of a background of how I kind of stepped into this work. I started off my career as a social worker with a clinical focus, worked in that field for about 15 or so years with addiction, mental health. And then I got sick. Like many of the practitioners who practice functional medicine, we usually have our own journey that gets us here. And I was just chatting with Tracy about that and saying how I had lost the function of my hands for a good year and a half, 2 years. And I was seeing allopathic doctors around the country, and I just wasn't getting the answers that I needed. In fact, I was told the pain was in my head, which I knew was not the case. And so I went back to school, studied functional nutrition, and I brought down my inflammation and balanced my microbiome. And I'm at a place where I have the function of my hands back. I'm leading a healthy life. I should say recovery ebbs and flows though. So some days I have good days and some days they're not so great. But at least I have the tools now to help get me back into the swing of things. So I'm going to talk to you today about that. We're going to explore the microbiome because it really is a foundation for health. So let me just get my slides up here for a second. There we go. So as I was mentioning, that foundation for health really is about supporting a balanced microbiome. So addressing the microbiome and biofilms, which I'll talk a bit about today, really is fundamental for immune system function, inflammation, which was my problem, detoxification, which was also my issue. And to have lasting therapeutic effects, we want to balance out that microbiome and address biofilms. So that's really what we're going to talk about this morning. Before I get into the presentation, I do want to acknowledge that the FDA has not evaluated the statements or claims that I make in this presentation. It's not intended to diagnose, treat, or prevent any type of disease, and it does not replace any evaluation by a qualified medical professional. So really, this is for educational purposes only, and we do encourage you to go back and work with your practitioners. If you see something in this presentation that suits you and you think, I want to try that, have that conversation with your practitioner. Any perceived claims that I make during this presentation about biobotanical research products are based solely on my professional and clinical experience. So they're not made on behalf of the company. So let's jump in here. I want to set the stage for a moment and talk about the microbiome. Human cells make up only 43% of the body's total cell count, while microorganisms make up the remaining 57%. So you did hear me correctly. We are more microbes than human cells. Your skin and your mucosa, which is a membrane that lines the cavities of the body, are covered with a wide range of microorganisms that include bacteria, fungi, yeast, as well as parasites. The majority of the microorganisms do colonize the gastrointestinal tract, but we can have a microbiome of the oral cavity, the GI tract, around different cavities of the body. Collectively, the microorganisms that colonize the GI tract are known as the microbiome. So if that's a familiar term to you, great. If not, you now know what the microbiome is. It's a colony of these organisms living in a certain area of the body. So I do want to mention that your immune system, as it encounters foreign threats, the crosstalk between your health, between your microbiome and the rest of your body becomes very important for your health. So I do want to say, considering over half of your body is made up of microscopic organisms, it becomes very important to maintain a delicate balance between harmful, beneficial, and those probiotic species in the microbiome. If you are one of those nerds like me, you're going to read through literature and you're going to notice that there's extensive medical literature out there that shows the imbalance of a microbiome will contribute to dysfunction of multiple body systems. So we might see inflammatory conditions pop up, cardiometabolic issues, neurodegenerative issues. I saw it play into mental health quite a bit. And then obviously we can certainly have gastrointestinal issues. So when the microbiome in the GI tract is off, oftentimes people think it is only going to affect the GI tract. And I'm going to shed some light on that today of how that isn't necessarily the case. We might see it affecting oral health as well, GI health, systemic health, all sorts of things. I don't think it would be right for me to talk about the microbiome without introducing epigenetics into the conversation. So if epigenetics is a new term to you, it's a study of how your behavior and your environment can cause changes that affect the way your genes work. So unlike genetic changes, epigenetic changes are reversible, and they do not change the DNA sequence, but they can change how your body reads that DNA sequence. So it becomes very clear when working with epigenetics that health or illness is a result of the environment that our genes are in, not the genes that we necessarily inherited. So given that, you see here, the microbiome in the center really is going to be impacted by all of these environmental and behavioral aspects like your diet and your lifestyle, chronic infections, infections that we aren't aware of. These are all a stress to the body, and they are going to affect that microbiome. So we want to ensure we are looking at all of these different environmental and lifestyle factors too when we're addressing that microbiome, trying to bring it into balance. This is a list. It's not all inclusive, but this is a list of major factors that are going to influence that microbiome. So certainly stress is a huge one. And this is one that we have some control over. We have a lot of control over the stress in our lives. So making sure that we are managing that stress appropriately, learning to say no when we can't take on additional tasks, really important. But also stress, people think about stress as just a mental component. Stress on the body can be from stealth infections, chronic infections, an impermeated gut lining, which we're going to just dabble on in the next slide here. These are all stress to the body. So this will impact the shape and the profile of your microbiome. Drugs, 25% of drugs are actually thought to disrupt the microbiome. So things like protein pump inhibitors, we might be prescribed that to suppress acid reflux, but we have some other strategies for that too. If we're inflamed and we're taking NSAIDs, oral contraceptives, or even antibiotics, these will shift the profile again, taking your microbiome from a balanced state to an imbalanced state. So looking at what kind of prescription drugs we're taking as well might play a role in your path to healing. Different treatments. I won't go through this full list here, but you can see there's different medical treatments that will also alter the microbiome. Diet plays a huge role. So what we're eating, not only what are we eating, but how are we eating? So stress, if I go back to that point, we need to be in a rested to digest state when we're taking in our food, if we want to absorb the nutrients, if we want to digest them appropriately. If we're eating in an aroused state where we aren't relaxed, we actually aren't creating the digestive enzymes that we need. The blood is not going to our digestive tract. So we may not actually break down the food appropriately, meaning we're not getting those nutrients. But in addition to that, if we're not breaking down our food properly, it's going to ferment in our GI tract, and that can lead to overgrowth of certain organisms that are problematic. So certainly there's a handful of things here that you can work on if we're seeing that your microbiome might be unbalanced as well. So I want to talk a little bit about gut barrier function and dysbiosis. When we have an imbalance in the microbiome, it's known as dysbiosis, or you may have heard the term leaky gut, permeated gut lining. These all mean there's been a breakdown in barrier function. So the gut barrier is a multi-layered system. In this picture here, it really shows three major components: the mucosa, you can see that right up here, this blue line here. Then we have the interstitial epithelial cells, and then we have our immune cells below. So the mucosal layer, when it's intact, it acts as a barrier to prevent harmful pathogenic organisms from coming into contact with the intestinal epithelial cells. Then the role of those cells, the epithelial cells, is to keep microorganisms, toxins, undigested food from entering into the bloodstream. And then that third component I was talking about, the immune cells, will help discriminate between harmful, pathogenic, and beneficial microorganisms, and then it will mount appropriate immune response if necessary. So over here on the left side, this is an intact gut barrier function, And on the right side here, you can start to see that that mucosa is broken down. So we do have a breach in that barrier function. The tight junctions of the epithelial cells are spaced out. So now we have an opportunity for, like I said, food, toxins, pathogens to get between the cells and then enter into the bloodstream. So when it comes to balancing the microorganisms in your gut, your intestinal epithelial cells here do play a major critical role in that. Think of them like panels on a fence. So they make up these tight junctions. And if a panel is missing, now we allow those organisms to get through. Luckily, we do have our immune cells to act as like surveillance and security if that barrier is permeated. Which is actually important because we need to have a semi-permeable barrier to aid in the digestion and fermentation of food. It helps produce essential vitamins, short-chain fatty acids. But when there's a breach and we continue to have organisms or toxins get through that interstitial cells and getting into the bloodstream, our immune cells are actually going to continuously mount an attack. And if it continues to do that, it can be a problem because we can see inflammation rise. So we don't want to have that chronically set off because we're going to continue to see inflammation. We're going to maybe develop more joint pain. Our symptoms are going to increase. And on top of that, we're going to increase your food allergies or your sensitivities. So it's almost like this vicious cycle. So we want to make sure we're soothing that mucosal lining and bringing those tight junctions back intact. So microbial shift disease, also known as dysbiosis, so that's another common term that you will sometimes hear. This is a term that's commonly used more in the dental world. So they talk about microbial shift disease all the time when it comes to periodontitis. But this can also occur in all areas of the body that have a barrier. So skin, blood-brain barrier, GI tract, oral cavity. They can have a breakdown in the barrier, and we can start to see a microbial shift disease from one area of the body to other areas. As you can see here, I talked about a little bit about the GI tract. So again, that leaky gut, nasal cavities, oral cavities. And I will talk a little bit about oral cavity because that I think is a place for sure that almost everybody can start with and take steps to balance that microbiome. Blood-brain barrier, I won't get into too much today, but we can see a breakdown in that area as well. And think about this for a moment. The blood-brain barrier is one cell thick, so it's a very, very delicate barrier to break through and penetrate. And the times when I spend my attention thinking about the blood-brain barrier is when I go back to neurological diseases like Alzheimer's, dementia, as well as mental health, anxiety, and depression. Oftentimes, we're finding an inflamed brain in those situations. When we have that shift, we can see local dysfunction, but we can also see it in other areas of the body. We're going to see thresholds and pain change as well. Our endocrine system, these are our stress hormones. Those are also going to be disrupted. Cardiovascular inflammation. And then this is the one that happened to me, autoimmune disease. So once I had that barrier broken down and some stealth infections in my body, I started to see some autoimmune diseases pop on up. But I can happily say today I have put that into remission with some functional work myself. So systemic conditions are heavily linked to the microbiome. We see this in the medical literature again and again and again. Non-alcoholic fatty liver disease is one that's spoken about a lot. So we're starting to see damage to the liver through imbalanced microbiome. Essentially, I mean, I won't get into too much detail here, but I could spend hours talking about this. One of the organisms that you might find harbored in your microbiome is gram-negative bacteria. The outer casing of gram-negative bacteria contains lipopolysaccharides. Also, sometimes you might see that written out as LPS. That itself is a metabolite of the gram-negative bacteria. And when it's contained in our GI tract, it's okay. But if we have a breakdown in that barrier function and it goes systemically into our bloodstream, we're going to start seeing inflammation. We might see joint pain. We might even see depression rise. Very quickly, LPS can penetrate into the blood-brain barrier. The other thing to know about LPS is it actually can be quite damaging to the liver. So I'm not surprised seeing non-alcoholic fatty liver disease on here. We also can see Alzheimer's, like I spoke about earlier, diarrhea, constipation, GI issues, mental health concerns, as well as a slew of different autoimmune issues here too. So you can quickly see how the body really is quite intricately connected. This I found quite startling when I read this, that people with an untreated tooth infection are almost 3 times more likely to have cardiovascular problems, such as coronary artery disease, than patients who have had treatment for dental infections. So if we're leaving those infections in our oral cavity, that is critical to address. Very quickly, they can penetrate into our bloodstream and then also cross over into the brain as well. In less than 1 minute of an oral procedure, organisms from an infected site can reach the heart, the lungs, and the peripheral blood capillary system. Not only can oral health affect our cardiovascular health, but we see it contributing to our mental health. We see it contributing to fertility and reproductive wellness. Obviously, we see a huge connection between GI health as well. Even your joint pain, small things that we think might be local to the body could be actually coming from a distal area of the body. So I'm going to move along into the discussion about dysbiosis, not about dysbiosis, about biofilms, which can contribute heavily to dysbiosis. Before we talk about oral health, because I do want to spend some time talking about that, but I want to introduce you to biofilms if that's not something familiar to you guys. So essentially what happens is these microorganisms, whether they're bacterial or fungal, they do something called quorum sensing, where they communicate with each other. So these organisms quorum sense to find each other. They then build a large enough colony. And once that colony becomes large enough, they now have the ability to excrete extracellular polymeric substance, otherwise known as EPS, which is an endotoxin, so it's going to cause inflammation too. So these organisms come together as a colony, they excrete the EPS. I like to think of that as almost like a force field. It's like an invisibility cloak to the immune system. So now the immune system can't go to work. It can't address organisms beneath that biofilm. And it sounds like they're tucked away neatly and we're just going to leave them alone, but that isn't the case. They do have a life cycle. They will reach a disbursement detachment phase where the biofilm will open up, and then the organisms will get back into their planktonic, that free-floating form of them, and they'll move around to different areas of the body, set up shop, and recreate another biofilm. So they can continuously reseed infection. So if you're one of those individuals who's on the roller coaster of symptoms, they come and they go and they come and they go, it could be that the biofilms have not been addressed appropriately. As I mentioned, the second point here, biofilms are made up of multiple organisms, which I think is really important for people to understand. They aren't one organism alone, and so they feed off of each other. Some will take the waste from one organism as nutrients for themselves, so they really work in this environment together. 80% of biofilms, 80% of microbial infections will develop a biofilm in as little as 2 weeks. So very quickly they develop, and as I had mentioned, they have a life cycle. So when they hit their disbursement detachment phase, they can also recreate in as little as a few hours to days. So very quickly, they can recycle that infection, and then you're going to start to see those symptoms coming back again over time. One of the ways that some practitioners will address biofilms is with antibiotics. Unfortunately, that usually does not cut it. And that's because biofilm bacteria more specifically, can resist up to 5,000 times of the antibiotic concentration that it would normally require to resolve that infection. So we start to see antibiotic resistance. We also start to see an even more imbalanced microbiome when we're bringing in the antibiotics into the equation. I do want to pause for a second and just say, I'm not downing antibiotics completely, because there is a time and a place where they need to be utilized. But I have seen the overuse of them cause issues for some folks. But certainly I'm not saying that they aren't valid, because they are a form of medicine that works sometimes. Biofilms in the GI tract will often contain lipopolysaccharides. So that, again, is that outer coating of the gram-negative bacteria that I just introduced to you guys, which is an endotoxin. So it's going to create inflammation inside the body. In addition to biofilms containing, a whole host of organisms and lipopolysaccharides, they also contain heavy metals. So they are a really sticky slime that's going to contain a lot of toxins as well. So the biofilms can be a continuous source of toxicity to the body as well. As I mentioned, they're going to contain metabolites from different organisms. They're going to retain the toxins, and they're going to retain toxins that are being produced internally. So we can be exposed to external toxins, but the organisms inside our body also excrete toxins. So we can produce toxicity internally as well. When organisms are beneath that biofilm, as I mentioned earlier, your immune system is ineffective. The immune response is not going to work. And typically what happens is just a generation of chronic inflammation. The LPS, very damaging to our liver. So we have inflammatory damage to the liver. And the biofilms itself is going to be a source that provides an ongoing microorganisms to create that imbalance. So we're going to continuously see dysbiosis occur if we aren't addressing those organisms in the GI tract. So I want to switch gears and talk a little bit about the oral cavity. So if biofilms is just like, well, new term, I haven't heard of this before, then I'm going to take one step back and say plaque. So plaque in the mouth is actually an oral biofilm. So we're all very familiar with plaque. So we do see that occurring in the oral cavity. And teeth are actually an opportunistic place for biofilms to create because they have a non-shedding surface, which is ideal for those biofilms to develop very easily. They attach to the surface, and then we don't have any shedding of the teeth. So unlike in the GI tract, we do have the epithelial tissue turnover, whereas in the mouth, we don't see that occurring. So we do need to mechanically remove the biofilm in the oral cavity. In the absence of proper oral hygiene, this can certainly be a key driver to dysbiosis, not only in the GI tract, but also not only in the oral cavity, which is obvious if that's where we're seeing the dysbiosis, but we can also see the connection between mouth and gut. So think of translocation, go back to that term microbial shift disease. What's occurring in the mouth can certainly re-inoculate or reinfect what's going on in the GI tract, and vice versa. If we have low stomach acid, or we even have GERD, so that esophageal reflux, if we see the acid coming back up, we could also be introducing organisms from the GI tract to the oral cavity. So I like to almost always pay attention to both areas whenever possible. You might be wondering what the pictures are all about, and you're going to get the EBGBs here in a moment. This is a biofilm on a toothbrush bristle, and this is it magnified. So this is a good reminder to switch out your toothbrush head. If you haven't done that in a while, you definitely want to do that. I also like to switch out my toothbrush head anytime I'm starting a protocol with somebody, or if we've learned that, there've been exposure to a certain organism like H. pylori in the home, we switch out everybody's toothbrush heads because we don't want to re-inoculate the body as well. So again, with oral biofilms, we're talking about how the plaque starts to develop and causes further progression of periodontal disease. So what we see here in the first picture where it says normal, this is a dental biofilm. We all kind of get that. You might wake up in the morning and have fuzzy teeth, or mid-afternoon having fuzzy teeth, depending on the microbial load in your mouth currently. But that fuzziness is plaque. So we start to see the development there. Not such a big problem. We can address this with brushing, but what happens when it starts to slip down into that periodontal pocket, we see more of an immune host response. So we're going to have some neutrophils, some macrophages, some T cells come into play. They aren't able to get rid of that biofilm because remember, immune response is not effective at a biofilm. And so they fire away, create some inflammation, and then we start to see further damage where that biofilm is now going to penetrate deeper into that periodontal pocket. We're going to continue to have an immune response, higher inflammation, and now we see the progression of periodontal tissue deteriorating. So we really want to address what's going on in that mouth. Oral statistics here. I found this astonishing. I had no idea that it was this high. So 77% of adults in the US over the age of 30 have been found to have periodontal disease. That is a super high number. I suppose it's not too startling because of the diet that most people eat. So if we're having, a standard American diet full of refined carbohydrates, we're smoking, these are going to put us into a higher risk category. Pregnancy, immune suppression drugs as well are also going to put us into a higher risk category for developing that periodontal disease. And as I mentioned, we have that microbial, we have the microbiome in the mouth. the GI tract, but we also have different areas of the mouth will host different organisms. So we can start to see shifts just between, the cheek, the rugae of the tongue, all different areas. And we want to balance the oral cavity just as much as we want to balance the GI cavity or the GI tract, because the organisms in our oral cavity also play a huge role in our health. Think of heart health. So some of the organisms in our oral cavity help to produce nitric oxide, and that's for heart health. So we want to address oral health, not only for heart health, not only for our mouth alone, but for systemic health as well. So we have over 700 species in the oral cavity, and in 1 liter, so we swallow about 1 liter of saliva a day. In 1 milliliter of that saliva, we have 100 million organisms, and that's just a milliliter. So you can imagine how we translocate organisms from the mouth to the gut, especially if we have low stomach acid. And so again, addressing that oral cavity. These are some common bugs that are found in the mouth. So most notably, we see Porphyromonas gingivalis, and I'm going to talk a little bit more about that one in a moment here, but heavily linked to cardiovascular disease, Alzheimer's, and we're also seeing it break down the barrier function of the GI tract. Streptococcus mutans, this is an organism that's really known for creating biofilm formation in the oral cavity, and also when we had that biofilm formation, that plaque continuously there, we can start to see cavities also be developed. So I often see a high level of Streptococcus mutans and also Candida albicans, which is a fungal species, when there's heavy loads of plaque in the mouth. Viral, we also see that in the mouth, so cytomegalovirus or HPV. So these are organisms to watch out for if we want to support our systemic health as well. This was a really interesting article that I found on the internet here. Pretty easy to find. So if you want to dig a little deeper into it, I heavily recommend it. It's from the Journal of Microbiology, and it talks about the microorganism Porphyromonas gingivalis and how it's responsible for periodontal disease, but also how it's responsible for translocating into the GI tract and resulting in dysbiosis, causing that impaired gut barrier function. We then see systemic effects that will take place. So we can develop atherosclerosis, diabetes, autoimmune disease like rheumatoid arthritis, and again, that non-alcoholic fatty liver disease. So we want to see what's going on in the body. We want to address what the root cause is, which could be coming from the oral cavity. I remember working with one gal who had ankylosing spondylitis, an autoimmune disease of the spine, and hers came from some old dental work that had gotten done in her oral cavity, and the person who had worked on the oral cavity, I guess perhaps some of his strategies weren't as effective, and she was left with some stealth infections that she wasn't aware of. So when they ran an MRI of her body, they saw some infections in the sinus cavity. They addressed that. Her autoimmune disease calmed down, and to this day, she's not taking anything to suppress it. So pretty interesting to see how those are connected. This was another article that I pulled looking at the connection between Porphyromonas gingivalis and Alzheimer's, and they certainly noted that there is a connection between oral health and Alzheimer's. And in fact, in the brain of Alzheimer patients, they found evidence of Porphyromonas gingivalis. And on this paper here, talking about Porphyromonas gingivalis and systemic health, this researcher concluded that there's no doubt that periodontal disease is preventable, and that Porphyromonas gingivalis is controllable. So if we can reduce the load of Porphyromonas gingivalis, we can start to see prevention of periodontal disease, and we can also start to see that direct impact on our overall health. So I want to shed a little bit of light on Candida albicans, fungal organism, and that's because a lot of people do experience a Candida load. This article was really interesting to me. It's a study from the American Society of Microbiology, and they found that Candida albicans colonizes the GI tract from the mouth. So what they did in this particular research study is they took pre-stool samples of individuals to measure their Candida levels in their stool. And then they had these individuals up with their oral hygiene. So they had them brushing, flossing, tongue scraping. And some of the folks actually brushed after every single meal. And what they found with the individuals who brushed after every single meal is that they had a dramatic decrease in the Candida post-stool samples. So over here, you can see the individuals who only brushed once a day, their post samples still pretty high and elevated with the Candida levels. And then these teal dots down here are the individuals who brushed after every single meal. And you can see their Candida levels dropped significantly. Now, if there's a significant overgrowth of Candida in the oral cavity, the GI tract cavity, I really don't think brushing alone is going to be effective. So I don't want to mislead you here. But I do think it is part of the protocol that needs to be addressed, because oftentimes people will only look at the GI tract and not address the mouth. And so we do have some solutions that can help support the oral cavity, and I'll introduce those to you guys here. But before I jump into that, I want to just give you a little bit of a summary of how oral bacteria can impact systemic health. So we see cardiovascular disease, stroke, fertility again, so reproductive concerns, inflammatory bowel disease, a whole host of systemic diseases is what I'm trying to illustrate here. So hopefully I've got that message across. So let's switch gears. I don't want to be so grim and dark this morning. I want to present some solutions and give you a little bit of hope, because certainly we can use botanicals to balance the microbiome of several different cavities in the body. So whether it's oral, or systemic, or even GI. So I'm going to take some time to introduce you to Biocide. It's one of the products from Biobotanical Research. They have a really small line. It's 11 products total. I'm not going to go through the full line today just for sake of time, but I thought I would pull the products that are most relevant to this discussion. So I am going to talk about Biocide itself. That is our flagship product. It's this one right here at the bottom. So Biocide Liquid is essentially a herbal glycerin tincture. It's made out of 18 different herbs and essential oils, and it's been designed to support microbial balance and immune health. So it has 14 herbal extracts and 4 essential oils. It's known to be a potent broad spectrum antimicrobial, so it's going to selectively support the clearance of multiple organisms at the same time. It's one of the formulas that I use often because it will help support the balance of bacteria and fungus. So I really like how we can utilize that for several different classes of organisms. It's able to disrupt and dismantle the biofilms, which hopefully you now understand is really key in getting lasting therapeutic effects. And we've seen clinical research showing that it's immunomodulatory through the herbals in there. And I'll talk a little bit about our throat spray and talk about the study we've done with that to show how we saw the immune modulating activity occur. And then lastly, inflammation is addressed through multiple activities. So not only are the botanicals, some of them, anti-inflammatory, but also when we balance out the microbiome and we address some of the harmful organisms, we start to see a reduction in inflammation. We're going to see less lipopolysaccharides bleeding out from the GI tract into the systemic blood flow, causing that systemic inflammation. So we have multiple ways that we are addressing inflammation here. So Biocide came out of a need. It was a really interesting story. It's one that I always share because I'm a very curious individual and I always want to know, why was a product created? How was it created? What was the need? So Dr. Fresco actually developed this line well in the, I think it was well over 30 years in the late 1980s. She was working at that time as in a holistic veterinary clinic. She has a love for animals and she has a background in traditional Chinese medicine. So what she was doing with a formula, people were astonished by some of the infections she was able to address with these animals. And so they came to her and asked if she had a similar formula that they could use on their human population. And she didn't, but she went away and reformulated the formula she was working with and handed it out to a handful of these practitioners, and they loved what it did to their patient population. So a handful of them were using it on their HIV patient population to suppress pathogen load and support immune function. Unbeknownst to Dr. Fresco, one of those doctors actually sent that bottle off to Great Smokies Labs, which is now Genova Diagnostics, one of the companies that does a lot of functional testing. And she got a call by the director at that time from Dr. Lee, which was very startling to her because he asked her, like, I don't know who you are, but the stuff in this formula is killing everything. And she said, is that a good thing? He encouraged her that it was an excellent thing. Was the most sensitive formula that he had seen. So he asked if he could put on a panel. It was put on a stool panel for over 250,000 samples. And it still came out being the most highly sensitive substance. And to this day, it's a formula that they still recommend when some of the GI diagnostics are run on the patients there. So really, it came out of a need, which is something that I love hearing. We have done extensive research on the formula, and I'm not going to share all of it with you guys for the sake of time here, but I thought I'd pull some of the most interesting stuff, or at least the stuff that was most interesting to me. We have done some pilot studies and some case studies, clinical studies. This particular biofilm study, we were looking at how Biocide interacted with a handful of different microorganisms. So on this particular slide, I've chosen a few organisms, couple organisms. We've got Pseudomonas aeruginosa on the top, and then we have E. coli on the bottom graph here. The top graph here, you're going to see on both of them, actually, you're going to see some control lines for both the planktonic as well as the biofilm. And then we introduced Biocide to the Petri dish. So we've done this in vitro at 50% its strength. And we wanted to see what would happen. So Pseudomonas comes down very quickly. But as I had mentioned, biofilms recreate very fast as well. But we saw at 24 hours, very low cell viability, which was very exciting to us because Pseudomonas is one of those organisms that contributes to upper respiratory infection, especially for those folks with cystic fibrosis. So very exciting for us to see this here. E. coli, it took a little bit longer, a little kink you can see, but both the biofilm and the planktonic do come down at 24 hours. And again, very little cell viability. So we're able to see that Biocide is effective at clearing this bacterial species. We also looked at Klebsiella, Pseudomonas, no, not Pseudomonas aeruginosa, Staph aureus, pardon me, E. coli, which I mentioned. What else have we looked at there? We also looked at Candida albicans, which is a yeast or a fungal species. We had very similar results again, which was exciting for us because Candida is quite invasive and typically will have that biofilm formation. So very exciting to see not only bacterial species, but fungal as well be addressed by these botanical formula. People always ask how or why, and so it's through multiple mechanisms. So one thing I will note about botanicals, I love working with botanicals because each botanical on its own will have several different mechanisms of action. So it might be anti-inflammatory, but it also might be antimicrobial. And then when we start layering botanicals together, they have a synergistic effect on the body, almost like an adaptogenic effect where it works with what the body needs. And that really becomes a science of nature because these botanicals need to survive out in nature with pests and other, organisms, microorganisms in the garden and whatnot. So they are able to survive out there. And when we pile them up together in a formula, they become very synergistic. So first things first, we stop that quorum sensing. So if you remember, I talked about quorum sensing and how that's a form of communication for these organisms. So we inhibit that. If they aren't able to find each other, they can't build a colony. That colony is not large enough, they can't excrete their biofilm. So that invisibility, that force field is not created to begin with. The next thing is we actually inhibit the initial attachment phase. So I didn't talk about the life cycle of a biofilm because of our time together here is a little more limited. But the life cycle of a biofilm includes an initial attachment phase. And once they hit that initial attachment phase, we see an irreversibility of those organisms attaching to the tissues. And now we need to bring in antimicrobials or other strategies to get rid of them. So if they aren't able to attach the tissues, a lot is easier to eradicate. We also see the inhibition of swarming motility. So that is the ability for these organisms to move around quite quickly in the body. So as I mentioned, in that disbursement detachment phase of a biofilm formation, the organisms break back open into their planktonic free-floating form. Then oftentimes they have flagella, which allows them to have that swarm motility. So they can move quite quickly and then find an area of the body and then recreate a biofilm there. So we can start seeing virgin areas of the body be affected by this organism as they move around. If that swarming motility is inhibited, the antimicrobials have a lot better time going to work. And so does your immune system at that point. I'm a huge believer in supporting our immune system because it does a lot of the work for us. And then last thing I think is very important here is the drug resistance. So oftentimes, like I mentioned, with biofilms, we see drug resistance occurring with antibiotics, but other antimicrobials as well in some cases. And so we were very excited to see here the combination formula of Biocide actually shuts down that efflux pump. The way I describe the efflux pump is like a mouth on a cell. So if you think of this organism, it has a mouth on it. It allows things in and out of the organism. It will allow nutrients, excrete waste. It will also excrete toxins or things that it knows it's at threat by. So if an antimicrobial or an antibiotic gets into the organism and it's like, whoa, this is threatening to my existence, it's going to just pump it out. And it becomes very quick and efficient at pumping it out. So we see that resistance build up very quick. When we use Biocide, and because the efflux pump is shut down, we don't see that resistance occurring. So very exciting to see that, because some folks do require much longer protocols. If I'm thinking about some of the more complex patients with Lyme, mycotoxins, autoimmune diseases, some of them do require several months, even a year or more, in some cases, depending on their health status. So we don't want to see resistance being built up to the botanicals. So we're very, very excited to be able to see that, because it allows us to continuously use it with that individual. So this is that flagship product. This was the one that was developed first by Dr. Fresco. She has 7 different applications of Biocide, and that's because if we're trying to target different areas of the body, we can use different delivery systems to get it there. So the liquid and the liquid fill capsules are my main ones for GI health. We also have a systemic application called liposomal Biocide and LSF. I'm not going to talk too much about that one today, but know it is available in the event that we need to go into our blood circulation, into lymph circulation. That one would be more appropriate. It's also one that I like to use for topical application. But I really wanted to hone in today on our GI supports as well as our oral health supports. So those are the ones that I selected for you guys today. So Biocide and liquid fill capsules, these are the ones that I utilize for GI health. And that's because they're going to address our microbiome in the GI tract more effectively than the liposomal. So our liposomal version kind of bypasses the GI tract and goes systemically into blood flow, whereas this one concentrates in the intestines. I do have a preference of using the liquid over the capsules, and there's a few reasons for that. I prefer the liquid because it's a lot easier to titrate. Extremely important to titrate the formula, especially when we're working with chronic conditions. We want to minimize any kind of die-off or a Herxheimer reaction where we might either see an exacerbation of our symptoms, perhaps flu-like symptoms developing. Usually these are short-lived, but with some folks who might have really poor drainage pathways, we might see that extended longer. We typically use a binder, which I'll introduce to you guys as well, to help offset that. But we can also reduce that by titrating slowly as the individual can tolerate it. So typically I'll start with 1 drop, twice a day, and slowly we will build that up over time to a more therapeutic level based on your situation. So I'll leave that to your practitioner and you to kind of have that conversation. And if you're working with a practitioner that's not familiar with the line, we do really great services for practitioners. So you can encourage them to call us. We offer consulting, we offer training to practitioners so that they can figure out how to most effectively use this product line with their patients. The other reason why I prefer the liquid over the capsule, not only for titration, but it's going to coat the mouth and the esophagus. And if you go back to that translocation piece, that's very important. Capsules I'll use sometimes when I'm traveling, but often I don't start off with them because 1 capsule equals 5 drops, which can be too much for some folks. I also like the liquid for pediatrics. So if you have kiddos in your home, we can base it on their weight, more effective that way. I do prefer people taking Biocide before a meal for best absorption. So 20 minutes before their meal, my mantra is when you're prepping your meal, it's time to take your Biocide, and it gets you into a nice routine that way. So in response to an oral application, Dr. Fresco actually designed dental side and toothpaste. This came from a naturopath who was using the dental side and toothpaste for herself, or pardon me, she was using just Biocide and on her toothbrush head. And she got some really good results when she went back to her dentist. So she approached Dr. Fresco and encouraged her to make a toothpaste, and that's exactly what she did. 20% Biocide, so it is a therapeutic grade toothpaste. You really only need a pea-size amount. So it does come at a higher price point, and I like people to save their dollars wherever they can. So pea-size amount. The first thing you're going to notice is less fuzzy teeth. So you're going to have really clean, slick teeth, no odd ingredients in there. It's a very gentle peppermint feel. So I do use it on all age groups from toddler all the way up to seniors. Perfectly fine to use it intermittently, but if we are trying to work with a problematic mouth, I would say you want to use it daily. And if you choose to use it on the daily basis, it's something you certainly can do. I've used it for well over a year or two myself, and it's something that I love. For more periodontal concerns, the toothpaste is great, but I would step that up by also bringing in the oral solution. So this is going to be a swish and spit solution. Think of it like a mouthwash, I suppose. 1 to 2 pumps in the mouth, swish it around vigorously, and then go ahead and spit. It's got some clove and myrrh in there, like the toothpaste, and that's going to help suppress that biofilm formation. But we've also added in CoQ10 and quercetin to this particular formula, and that's known to help support the oral tissue. So if we need to support that, that's a great ingredient there. And this one is our liposomal version. So it's actually Biocide and LSF mixed with a few other ingredients designed specifically for the oral cavity. I'm going to jump over to the throat spray. It's one that I wasn't going to include, but then I thought, you know what? It's one that I live off of. This is probably the one product, if I could only choose one from the line, it probably would be the throat spray, especially based on our clinical research. So this was done with college athletes. We were measuring their secretory IgA levels prior to working out, and then we did a post-workout as well. So we swabbed the back of their throat, got their baseline levels, giving 3 sprays of the throat spray to the back of the throat. That's what I would say a single serving for an adult would be, 3 sprays. For a kiddo, I'd do 1 spray. Had them work out, brought them back after a little bit of a rest period. So 60 minutes after that initial throat spray, we re-swabbed, and we noticed that they had a 66% increase in their secretory IgA levels, which is superb in my opinion. Based on that particular shift in their secretory IgA levels, which is an immune marker, by the way, I will use the throat spray every hour on the hour if I feel like I've caught something. And that's just to support my immune system so I can try to help fight off what it is I may have caught. If I'm using it prophylactically, I don't think I'm under the weather, I'm just using it here and there, it's something that I will utilize daily, a couple sprays as I'm out and about. And then on those times where I'm definitely under the weather, 3 sprays every hour. And then I pair it up with another product that I'm not going to introduce to you guys today, but I will make mention of it, is Olive Virex. It's a high potency olive leaf formula, which is excellent for seasonal support. I wanted to talk about 2 more products before we end here. GI Detox, this is a binder. It's really important to bring in a binder anytime you're using any type of biofilm disruptor or even antimicrobial, because as I mentioned, these organisms, as they die, they create die-off. So we want to bind up to that as best we can to make for a more comfortable protocol or a comfortable detox. So GI Detox is a multi-layered binder, which is key. It's going to have some activated charcoal, some zeolite clay. We've got some humic and fulvic acid in there, which is lovely for that pesticide absorption. What else? It's got some, I'm not sure if I said it already, but MMST silica, so another binding agent, some apple pectin, and then all binders have a drying effect, regardless of who you purchase them from. So we've added in a little bit of aloe to help support the mucosal tissues as well of that GI tract. I would encourage you to stay hydrated if you're taking a binder. And I like to have people follow up with a full glass of water when they take GI Detox, and that typically helps offset any type of constipation that may arise. And then there's other strategies that we can also implement, like magnesium or whatnot, to address any kind of constipation that may come along. It certainly isn't the case for everybody. This one you do want to take on an empty stomach. So no food, no medications, no supplements for a good hour or 2. Take the GI Detox, wait another hour or 2. So for that reason, I typically have people take 1 or 2 capsules at bedtime. Unless they're taking a sleep aid before bed, then I'll have them take it in between their meals. That's a nice time to kind of fit it in. If you're working with kids, this one can be opened up. In fact, all of our products can be taken out of their capsule if necessary. Proflora 4R, last product. This one is a spore-based probiotic. If you aren't familiar with spore-based probiotics, I hope you get familiar with them because they're very hardy. So they can survive very harsh conditions like our stomach acid, UV raises. They typically also, what's on the bottle, so the CFU count on the bottle, 99% of that is going to make it to your GI tract. And that's because it's not damaged by stomach acid, whereas typical probiotics that aren't spore-based or are not enteric-coated, about 3% of them make it into the intestinal tract. So you're missing out quite a bit there. The spores that we use in here are 3 known spores: Bacillus subtilis, coagulans, and clausi. These spores alone act they create their own antimicrobials. So that's going to help with balancing the microbiome. They also are going to balance out the microbiome in different ways as well, creating short-chain fatty acids. In addition to the spores, we've added in quercetin. So Dr. Fresco very much is an individual who likes to layer in ingredients, specifically botanicals. So true to her nature, she put in quercetin because that's known to help support intestinal permeability repair, 100 milligrams more specifically. So that's what we have in the capsule. It's also a nice one if we have histamine response, mast cell activation. I love bringing in quercetin. Marshmallow and aloe are also in this particular formula, and that's really soothing to the mucosal lining of the GI tract. So it's almost like you're taking 4 capsules, but it's in one. 1 capsule a day will suffice with this one. I have gone up in some cases, but typically 1 will do the trick. So I hope I've left you with some strategies, shed some light on what the microbiome is, how to balance it. If you have any questions, feel free to reach out. If you're a practitioner, like I said, you're more than welcome to get in touch with us. Or if you're a patient and you're working with a practitioner that's not familiar with the line, we're more than happy to kind of help them out as well. To thank you for your time, I wanted to offer you guys a code here. So 10% off biocide.com website using 21WWVS10. I believe also the Weiner Wellness Center carries the botanical line. I'm not sure particularly which products they carry, but I am aware that they do carry some of them. So you can also find them at the Weiner Wellness shop as well.
Absolutely. Thank you so much. That was fascinating. Great presentation. And I mean, I think it really puts emphasis back on the health of our microbiome, not only in our gut, but everywhere. So
Yeah.
I really appreciated your perspective on it. There is one question. It says, why would someone develop between teeth cavities when they brush and floss daily and have overall very good dental hygiene? Dentist, of course, recommended fluoride.
Interesting. Okay. So really, really interesting question, because I was actually reading an article recently on oral hygiene, and it put the emphasis on poor oral hygiene developing periodontal issues and cavities, but that also isn't the case. So we can have great oral hygiene, but if we haven't been able to balance that bacterial load, like Streptococcus mutans is a big one, we are going to see the development of dental caries. So I suspect you've probably done a great job with the oral hygiene piece, but you might need to bring in some antimicrobials to balance out the microbiome as well in the oral cavity. Any particular product you'd recommend out of your line? I would probably do, in this case, I would do the toothpaste, and I would also do the Dentalcide LS. And if you're really diligent, it sounds like you already are with the brushing and flossing daily, I would try to encourage you to brush after every single meal. And if you can't get to the brushing, the Dentalcide LS at least is an easy kind of quick swish and rinse to do that alongside it. Great. Well, thank you so much. I really appreciated you being here. Guys, check out this great line that's at the Weiner Wellness Center. Remember, products are 30 to 50% off all week long. Amazing savings. And thank you for the code as well. Practitioners, if you're interested, contact Alia. She's happy to help you. So thank you so much for being here. Guys, stay tuned. We will be right back at 10 a.m. Eastern Standard Time with Dr. Baker. She's an allopathic physician, and she's going to be talking to us about bone density and bone health. So have a great day. Thank you so much. Cheers.